Hi, my name is Marty Shankman. This is Elvis, and this is a video series entitled Elvis Does Estate Planning. Hi, my name is Marty Shankman, and this is Elvis, and this is a video series called Elvis Does Estate Planning. This topic is on healthcare proxies. What is a healthcare proxy? Our goal is to give you some practical, useful information to understand this very important legal document and some of the decision making that you want to use when you prepare one for yourself. What is a healthcare proxy? It's a document. It could be called also a medical directive. Some people call it an advance directive. But whatever the name is that it goes by, its purpose is the same. It's to designate an individual, called an agent, to make healthcare decisions for you. Now, it's important to understand the distinction and the sort of common ground between living wills and healthcare proxies, and there's a separate video clip on living wills that you may also want to watch. A living will is a statement of your healthcare wishes, in contrast to the healthcare proxy or advance directive, which is the subject of this video, which is designed to name somebody and empower them to make medical decision making. They're very closely related because obviously you want your agent, your healthcare agent, your medical proxy, to follow the wishes set forth in your living will. However, because your healthcare proxy document has to empower your agent to make decisions, many of your personal wishes that are set forth in your living will also be embodied in terms of powers or rights that your agent is given in your healthcare proxy document. So it's important to understand the relationship between the two of them. I know it's a very important topic, Elvis. Now, the most important decision in your healthcare proxy is who you name as your agent. You don't simply want to name, say, a child because you feel obligated to, it's a natural thing to do, or gee, that's what everybody else is doing. This is not the place to be sentimental as far as what other people think. This is a place to really do some soul searching and say, who can really carry out, you know what, you're a little fidgety. We're going to put you down, and we'll pick you up for the next video. You want to really think honestly, who can carry out these wishes? These are not easy decisions. You may want to name a child, but can your child pull the plug on you if that's ultimately what has to be done? You may have strong religious convictions, and it may be more important to name a child or family member that has similar religious convictions to you than it is to name somebody that has a certain relationship to you. So if you have a religious preference that's very important to you and is different from your family as a whole, you have to really think, can or will my family, I hear Elvis shaking in the background, it's okay, can or will your family carry out those wishes if they have very different beliefs? You cannot ask somebody who's a fundamental, and I'll leave out the name of the religion, but any fundamental religious belief to pull the plug if you have a terminal illness if that violates the core and the very fiber of what their beliefs are. It won't work. So give some real thought to who should be your agent. Once those types of issues are done, you also want somebody level-headed enough. Emotionally, it's always a very difficult thing to make end-of-life decisions for anybody. It's never easy. And even if you are suffering with a chronic illness and you know very likely how and when death will come, it doesn't make it easier for the people given this very serious and difficult responsibility. So give some real thought to who it should be. Next, do not ever designate joint agents. In some of the other videos where we talked about fiduciaries, we say how you can name co-trustees or co-agents. Under a healthcare proxy medical directive, you want to name one agent. If that agent cannot serve, then you want the next person that you've designated to be the next or successor agent. You don't want to name joint agents. First of all, in a number of states, it's not valid, and the reason is obvious. How can you make these tough decisions if two agents disagree? And even if it's valid in your state, do you want to have a situation where two people may come up with different issues or responses? How's a doctor going to make a decision? There's often not a lot of time. So it's very important to name one agent, name successors. But if you, say, have 4 children and you want all 4 children to collaborate on the decision making, how do you deal with that? You can name the child that you feel should be the first or primary agent first. Put non-binding, because you don't want a situation of creating indirectly joint agents. I suggest but do not require that Jane, my daughter, who's my first agent, communicate and discuss her decisions with my other children. It's enough to let Jane know in the document that she needs to talk to everybody without creating the legal impediment of joint agents. Not a simple decision. Make sure a lawyer looks at it so you don't jeopardize your document. Another issue, do your agents really know your wishes? Well, if you've done a living will, they should. Let's step back for a minute. If you signed a standard boilerplate living will form without really reading it, it may not even reflect your wishes. But more importantly than that, there's nothing that can help an agent understand better what you want than having that tough, difficult decision of making a discussion with them. Susie, I need to sit down with you. I'm having some health issues. You're my agent. We got to talk about it. Not easy, not pleasant. Reality is the vast majority of people don't do it because it is uncomfortable. You need to make that decision. You need to take that step. Next, once you've gone through the process, where do you keep this document? How many do you sign? One recommendation, and you should discuss it with your lawyer to make sure there's no state law issues that are different, you may want to sign at least 3 of the healthcare proxies. You keep one, your lawyer keeps one, your first agent keeps one. If you have 2 children and one child, say the oldest is named first and the younger child is named as the second agent, maybe you do 4 originals and each child gets one so no one's left out. Bear in mind you don't want to have so many that it becomes burdensome. You don't want to have so few that in an emergency they can't be found. Most healthcare proxies will have a provision that a photocopy is valid. You may want to add in the future that a PDF or electronic facsimile should be valid. You should have it on file with your physician, and if you're ever going to the hospital, take a copy so it can be inserted into your medical records. Vitally important that the document be inserted in your patient chart, because if it's not part of your medical records, the physicians that are attending to you will not know what it is that you need done. So that's something that's important to follow up as well. Final point, bear in mind that a healthcare proxy, and this is similar to the discussion in our videotape on living wills, is not just about pulling the plug. You need to give some very specific powers and directions as to what the agent should or shouldn't do. So for example, end-of-life decisions include hospice care. Can the healthcare proxy that you name hire a companion care? Do you want to be retained living in your home with home health aides? Would you prefer to be in some type of facility where there's more companions and social environment? Medication, pain relief decisions should be in your living will, but you want to authorize your healthcare agent to carry those out. Funeral, burial, cremation, whatever it is that your wishes are, the more succinct, precise, and clear that you are, the less likely your family will be traumatized trying to figure out what it is that you want. So to conclude our discussion, a healthcare proxy is a vital document. Everybody over age 18 should have one. Don't sign the standard form without reading it. Make sure you consider all the implications. Be very careful and thoughtful about who you should name as an agent, and make sure that you do it formally with a lawyer so that you know it'll be valid. Thank you for joining us.